Hey there everybody, welcome to HealthWell. Did you know that high blood sugar can lead to a diabetic coma? Diabetes mellitus is a medical condition characterized by hyperglycemia, or high blood sugar, where the body can't effectively utilize glucose for energy production. There are various hyperglycemia symptoms that occur due to decreased production of insulin or compromised insulin sensitivity. There are different types of diabetes, including type 1 diabetes, type 2 diabetes, and gestational diabetes, which occurs during pregnancy. The main concern for diabetics is controlling their blood sugar levels, which is why it's important to be aware of hyperglycemia symptoms. Therefore, we will help you understand the signs of high blood sugar for better diabetes management. Number 1. Excessive thirst. Hyperglycemia quite literally translates to high glucose levels in the blood. In the case of optimal health, the cells in our bodies are capable enough to absorb the glucose in the blood. They then convert the glucose into energy, and the levels of glucose in the blood drop. People with diabetes are unable to utilize their blood glucose by converting it into energy without the help of medication. Therefore, when a body is in a state of hyperglycemia, it needs another way to remove the extra glucose. Excessive glucose is removed by the kidneys. The kidneys filter out the glucose, and it is added to the urine. However, the presence of glucose in urine changes its osmotic balance, which is why the kidney needs to filter more water into the urine. This leads to a decrease in water in the body, causing dehydration. This dehydration is the reason behind excessive thirst, as the body needs to compensate for the water being lost. Number 2. High fatigue. Glucose is the main source of energy for all the cells and tissues in our body. So, you must be wondering what it is about hyperglycemia that makes it so harmful. It is easy to become confused because hyperglycemia means high glucose levels. However, the glucose levels are high in the blood, not in the cells or tissues. This means that glucose is circulating in the body, but it is not reaching the cells and tissues. The reason for this can be because either the body is not producing enough insulin, which is the hormone that helps absorb glucose, or the body's cells have become resistant to the effect of insulin. The cells therefore stop receiving enough glucose, which is their main source of energy, and for this very reason, fatigue is felt more often and faster than usual. Number 3. Frequent urination. An extremely common symptom of hyperglycemia is frequent urination or polyuria. Polyuria is a condition in which people find themselves urinating more than usual. The passing of greater than 3 liters of urine in a day is known as polyuria. One of the main reasons for polyuria is high blood sugar levels. As we now know, the body needs a way to remove the excess glucose from the bloodstream. The best way the body can do this is to filter glucose from the kidneys into the urine. However, because of the osmotic power of glucose, water is also pulled from the blood and added to the urine. This leads to dehydration, which is compensated by drinking large quantities of water. The combination of drinking large quantities of water and removing glucose from the bloodstream leads to frequent urination. Number 4. Weight loss. It might sound surprising, but high blood sugar can lead to weight loss. Most of us associate diabetes and high blood sugar levels with being overweight, but one of the most common signs of hyperglycemia is sudden weight loss. As you know by now, the high levels of blood glucose do not mean that it is reaching the cells and tissues of the body. Of course, the body still needs energy from somewhere. To keep the cells, tissues, and organs working, the body requires an alternative to glucose for energy. In this situation, your body begins to use stored fat and protein from muscles to create energy. This leads to rapid loss of weight as the body has a limited amount of muscle and stored fat. Number 5. Headaches. Headaches associated with hyperglycemia usually are slow to appear. However, the higher your blood sugar levels are, the worse your headaches will be and the longer they will persist. These headaches occur due to a combination of effects caused by hyperglycemia. Dehydration, fatigue, and sudden weight loss all contribute to headaches. Additionally, hyperglycemia affects hormones such as epinephrine and norepinephrine, which causes vasoconstriction or constriction of the blood vessels, leading to persistent headaches. Number 6. Blurry vision. Hyperglycemia can cause blurry vision on a short-term and long-term basis. If the hyperglycemia is controlled, the blurry vision improves greatly. Short-term blurriness is due to the acute effects of hyperglycemia, while long-term blurriness occurs due to uncontrolled diabetes. However, if you're successful in keeping your hyperglycemia in control, the short-term effects will disappear, but long-term effects may persist. High levels of glucose lead to water being pulled from other parts of the body. These fluid shifts can lead to eye swelling, which causes the shape of the eye to change. This change then makes it harder for the eyes to focus, which causes blurred vision. Persistent hyperglycemia can lead to the small blood vessels of the eye and the retina being damaged. This causes blurred vision that may persist even after hyperglycemia has been controlled. If you're finding this video interesting so far, then make sure to hit the like button, and why not subscribe so you can keep learning more? It's free! Number 7. Increased hunger. An extremely common symptom associated with hyperglycemia is increased hunger, or polyphagia. This can be surprising when another symptom of hyperglycemia is sudden and rapid weight loss. However, if you look a little deeper into the reason behind this symptom, it will start to make sense. As discussed earlier, the body's main source of energy is glucose, which in a hyperglycemic's case is abundant in the blood but not in the cells of the body. This glucose in the bloodstream is not being absorbed by the cells due to a lack of insulin or because the cells have become insulin resistant. In either case, glucose cannot be used as energy, and it is unable to provide nutrition to the body. In response to this, our body causes our brain to release hormones that cause hunger because it needs nutrients. This is why people with hyperglycemia experience frequent hunger pangs despite eating adequately. Number 8. Difficulty in focusing or concentrating. Having difficulty focusing is a symptom that can easily be overlooked or confused with any number of other conditions. However, if you are experiencing this symptom along with any of the other symptoms we have mentioned, it can be a sign of hyperglycemia. The reason hyperglycemia can cause problems in concentration is due to the body being unable to utilize the glucose in the blood as a source of energy. When the cells in the body are unable to convert glucose into energy, your ability to concentrate decreases, as your brain also needs glucose to maintain its energy levels. Number 9. Slower healing of wounds. When glucose is filtered out of the body via the kidneys, water is also removed from the body. This water is pulled from the blood and cells in the body. When water is removed from the blood, it becomes thick and sluggish. This also causes a decrease in blood flow. When blood flow slows down, not only does it take longer to deliver nutrients to the body, especially the lower limbs, but its ability to remove toxins also decreases. This is why people with prolonged hyperglycemia find that it takes their wounds a much longer time to heal than other people. Number 10. Nerve damage. Excessive glucose levels in the blood can cause damage to our smallest blood vessels, also known as capillaries, that are responsible for providing the nerves with nutrients and oxygen. When these blood vessels are no longer able to maintain the nutrient and oxygen requirements of the nerves, they begin to die. Unfortunately, nerves are unable to regenerate, so even if the blood sugar level is brought under control, the nerves do not return to normal. The damage to nerves is usually noticed by a tingling or numb feeling in your hands and feet. People also experience a burning sensation in their hands, arms, feet, and legs. These limbs are usually the first parts of the body to lose their sensations due to nerve damage. Number 11. Recurrent infections. Another symptom that is often seen in people with hyperglycemia is slow healing and recurrent infections. With hyperglycemia, the flow of blood through the body becomes sluggish as the blood has become thick. As the blood is responsible for flushing out toxins and providing nutrients to all parts of the body, when its flow slows down, it is unable to effectively carry out this role. White blood cells are a part of the bloodstream, and when blood flow is slow, these cells are not able to reach bacteria and viruses fast enough to prevent them from spreading disease. This leads to a slow recovery of infections and repeated infections in those dealing with hyperglycemia. Number 12. Swollen gums. Hyperglycemia can decrease the effectiveness of your immune system, making you more susceptible to infection, including areas such as your gums and teeth. You may find that your gums are becoming swollen and receding, or that your teeth are becoming looser. You may also find that your gums have developed ulcers or pus. Infections such as these take longer to heal due to the effects of hyperglycemia. Have you experienced any of these symptoms before? Will you now be able to recognize these symptoms in yourself and others? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.